Good morning, everyone. Thank you for joining us. Today is Friday, May 22. I'm Dr. Allison Iwardy. I'm the Commissioner at the Chicago Department of Public Health. And of course, every day we take your questions on The Doctor Is In, Ask Dr. Iwardy. You can put questions into the box on Facebook, or you can send us your questions via Twitter with the hashtag Ask Dr. Iwardy. So we have a guest today. For those of you who saw the press conference yesterday, at 1 o'clock, the mayor announced some new mental health investments that the city is making in the time of COVID. And so we wanted to do a follow-up. So part of the reason we're at a slightly different time today is because there's a whole lot going on, but we, as always, want to make the time. So this is Matt Richards. He is the Deputy Commissioner for Behavioral Health at the Chicago Department of Public Health. Licensed clinical social worker, also has a Master's of Divinity, and really one of the busiest people at CDPH, and someone who I think has brought a lot of thought to our work in the behavioral health space. So thanks very much for being
thanks for having me.
I appreciate it. Just to help folks start putting in questions, can you tell us just a little bit about what you do at CDPH normally, and then a little bit about how COVID has changed that?
Yeah, absolutely. So I supervise the Bureau of Behavioral Health, and at the health department that really consists of three major programs. So one is mental health, which includes our city mental health clinics. We have 5 clinics, and then also organizations in the community that we fund. It also includes substance use and recovery programs, and then violence prevention. So we have a very large body of work. Lots of those topics are kind of regularly in the news and things that people are thinking about. We really had developed pretty significant plans in all 3 of those areas before COVID. And a lot of the things we were working on are things that we want to continue working on, but we've definitely been making some changes as COVID has continued to unfold. And so I'm excited to be able to talk to you about that.
All right, sounds good. So if you've got questions related to mental health, anything you saw in the announcements yesterday, substance use, violence prevention, how all of that fits in with COVID, start putting the questions in, and we'll go ahead and do a quick data update. So as always, you can go to chicago.gov/coronavirus, and right up at the top is our latest data. Today at 1 o'clock, there is going to be another press conference, and this one today is actually going to be a little bit data focused. We're going to talk about our reopening metrics in Chicago and share some of the progress of where we are. So I encourage people to tune in, and then tomorrow on Facebook, we'll go into a lot more detail about all of those reopening metrics. So lots of data, lots of things getting updated. High level, we are at 39,756 cases of COVID-19 here in Chicago residents. So we'll pass that 40,000 mark today in terms of cases. We are also at 1,830 deaths among Chicago residents. That was an increase of 973 cases and 42 deaths since yesterday. So, you know, we're heading into Memorial Day weekend. We're feeling cautiously optimistic about the fact that we're starting to see finally our numbers starting to downtrend, but we're still, you know, we added almost 1,000 cases yesterday, and so we are in a place still of needing people to not have unnecessary opportunities for infection. We're still under the stay-at-home order, you know, that's in place really through the end of May there, and we need people to not, you know, not unnecessarily have infection. Illinois is at 102,686 cases and 4,607 deaths. Let's pull up just quickly our epi curve. I'll remind you that's where we just have the along the x-axis at the bottom. This is just day by day by day how many new cases we have. And you can see that where we do an average of this over 7 days, and we'll share some more detail on this tomorrow, but even just from a distance, you can see that we are on the downtrend a little bit, just beginning to be though. And so we'll be watching this very closely, especially over the next week or so, really wanting to see that continue. And then let's pull up the other graph. Our progress on testing is really looking good. Have done almost 167,000 tests here in Chicago. Our 7-day average is up to 4,307 tests per day. I'll remind you we're aiming for at least 4,500 tests per day, so that's good progress. And our percent positivity, again, that's just of all the tests that are done, what percentage of them are positive, has gotten down to 19.4%. That is now below our 20%, which is great. We do want to get to 15% in the community setting if we can. many other cities are well below that, and we are anxious to see that keep coming down. So check out the website for more. Tune in at 1 if you want to see more details, and certainly if you're interested in data, come back tomorrow at 11. All right, so let's get back and talk a little bit more about how your work has been sort of fitting in with COVID. So first, if people didn't see the announcement yesterday, let's do an overview of what that was about.
We announced 3 big things yesterday. All are new things that the city is doing. So the first thing is that the health department is funding 4 community mental health organizations that provide community-based services for folks with more significant mental health concerns. So things like schizophrenia, bipolar disorder, co-occurring disorders, which usually means when somebody has a mental health diagnosis and a substance use diagnosis. We've not historically funded this kind of team-based care where you actually are really delivering care out in the community, in someone's home. It doesn't assume that the person's always coming into the clinic. It's a really important way of providing a higher level of care. And so this is the first time that the health department has ever funded another organization to do that. We actually did provide some of these services about 30 years ago, which I learned in the last few days. But so that's one thing. We're really excited about it, excited to get started with those organizations. And I think it's going to connect to some of our plans about being able to transition some persons in that group into more permanent and supportive housing. The second piece is around telemedicine. So if you may be familiar that increasingly healthcare providers are delivering services digitally, through your computer, through your phone, using a broadband connection. That's something at the health department, in our mental health clinics, in our STI clinics. We really want to be moving in that direction. It removes barriers for people. People can actually check in with their provider from their own home. So I think it's really exciting in our mental health clinics because, as you know, Dr. Arbery, we have 5 clinics. This is going to, that are across the city, but this is going to give us the ability to kind of expand services really to anybody in Chicago that needs services, right? You don't need to physically walk into a clinic unless you want to, and in-person services continue to be important. The other thing we're going to be doing is we're going to be identifying a consultant who's going to work with other mental health care providers in the city of Chicago to help them think about how are they adapting their programs during COVID to deliver services in new ways. Part of that's around the use of digital tools. Part of it's around thinking about things like being trauma-informed or trauma responsive. This is a very traumatizing event. It often adds to previous traumas that people have experienced in their lives, and so it's really important that providers understand what that actually practically means to deliver care that's trauma-informed or trauma-engaged. The third thing that you may have heard about is that we partnered with a digital mental health company called 10% Happier to create a free set of digital mental health resources. It's meditation aids, sleep aids, guided talks. These are things that anybody in Chicago can use. They're free. I confess myself, I had not historically used a lot of those tools and have started to use them and incorporated them into my own kind of self-care. So those would be a good resource for you, if you're finding yourself having difficulty sleeping, higher levels of stress, just feeling potentially, like you're lacking some hope as you think about the future. These are some things that can provide you with some grounding. So I think it's another example about how we're thinking about digital tools.
Yeah, great. So I looked at the website last night.
Yeah.
So it's the actual link is as always on the chicago.gov/coronavirus, but it's a Windy City Wellness page,
That's
right? 10%.com
/Chicago.
Perfect.
That's right.
So I looked at some some meditations and sort of checked it out. I couldn't sleep very well last night, and I said, let's check it out. Yeah, exactly. So encourage people to look at that. Okay, good. Already some questions and things to sort of talk about here a little bit. So can you talk a little bit about how this sort of telehealth or telemedicine platform is different? Like how has it changed what we've already seen in clinic, Yeah,
so for, what we started doing, when the shelter-in-place order went in place in our clinics was, our clinics are a really important part of the mental health safety net. And so it's important that we're able to continue to deliver services. So we did stay physically open for folks that needed, for instance, an injectable medication, if there was a crisis. Sometimes, in-person care is incredibly important. If a person didn't have the ability to engage with us, let's say they don't have a phone, let's say they don't have internet access, they don't have a computer, right? We want to stay engaged with our patients, right? So that was part of it. But what it's allowed us to do is to give patients the ability to have actual psychotherapy sessions over the phone, which is what we started with, was telephonic, because we didn't have a telemedicine tool that the city had purchased. And what we even saw, and Dr. Arwide, I talked with you about this, is we've seen increases in the number of services, particularly in individual psychotherapy, which is a service we offer, and also in case management services. And if you kind of map those over the last 3 months, you see that. And so I think it's a few months of data, but I think what it does indicate is something that some of our other colleagues have said, is this removes barriers for some folks. If you can't physically come into a clinic every week, if you have childcare challenges, if you have transportation challenges, to be able to check in with your provider sitting at your house can be a really powerful option. It's one option for people.
Absolutely. And our services they're free. They're regardless of insurance, regardless of immigration status, regardless of income, where you live in the city,
if you are a citizen in Chicago and you need services,
a resident in Chicago,
you can give us a call. And we would love to be able to find out what you need and to be able to support you.
And there's a mental health link on the chicago.gov/coronavirus with details about that. So let's talk a little bit more. Someone's asking to tell us more about this outreach kind of mental health work, and I'll add on to that assertive community treatment. It's a particular modality, but people probably don't know a whole lot about what that is. And if you could talk a little bit about more details there. And I know that it links to some of the work we've been doing among people who are unstably housed too. So fill that in a little bit.
I'm going to do a little bit of a history background, if that's okay for folks. So there used to be a real practice in this country that a lot of folks with more serious mental illness actually were in state-run psychiatric facilities. There were hundreds of thousands of Americans that literally kind of permanently lived in these state psychiatric facilities. And there was a decision that was made in the 60s and 70s to kind of move away from what we call institutionalization. That's where a person is kind of permanently living in one of these facilities, and actually to be able to live in community, right? And to be able to experience recovery in community. So this idea that you can have, for instance, a diagnosis of schizophrenia and still be well. You can still live independently. You can still have a meaningful life, right? That's a really, really important idea. And so the idea was people weren't going to live in these state psychiatric facilities. They were going to be out in community. And so we started developing these community models of care, where we actually deliver services to people in their home, in their community. It's team-based care. So there's a care team that provides support to you. Usually a psychiatrist and a physician is on the team, a nurse is on the team. There's probably social workers, and then there's peer workers and outreach workers on the team. And they're available to you 24/7. So if you have needs, if you're feeling your symptoms get worse and you feel like, oh, maybe I need to go to the hospital, you can check in with your team and they can kind of move into action to get you the support that you need. And it allows people to live independently, to be able to have their own housing, perhaps to have meaningful work, to be a part of a community. Those are all important parts of being well, right? It's about having a home. It's about having community. It's about having purposeful work. It's not just about your symptoms. And so these teams are a primary way that we support people. One of the challenges, though, that happened is we never really fully built out that community-based care system. And so one of the things I'm really concerned about, I know you're really concerned about it, is that we, across big cities across this country, you have very high percentages of folks who are chronically homeless who have serious mental illness.
Right.
And it's really a staggering thing that we have not really built that system. And so I think to support folks, which is housing, it's this community-based care. So was so appreciative and grateful to you and to the mayor that you recognized that it was appropriate for us as the city to start to fund some of these services and to be able to have conversations with our colleagues in housing to say, how can we pair these two powerful interventions together to support folks? Right? It's really the most humane and appropriate, I think, way to respond.
Yeah, and we've had folks on, as you know, if you follow along with us regularly, a number of different people who work in the mental health space and people who work in the space of supporting people who are unstably housed. And I think COVID has sort of brought even more attention to this together. So, for example, as you know, where people who were in this very highest risk for the severe outcomes from COVID, people who were in the older age groups and had these serious underlying physical conditions, and were living in shelters at the same time that, you know, there was a lot of work to have the physical distancing, the 6 feet that was needed within the shelters. There also was work to what we would call shield, meaning pull some of those highest risk folks who were unstably housed and actually house them in some of the hotels and some of the other settings where there can be individual sort of rooms. And that's been great for physical health, and it's been good in a lot of ways because people have gotten some of that mental health support. But as we're thinking ahead to moving some of those highest risk folks, many of them also have, you know, concurrent
that's something I want to talk about.
Yeah.
I mean, one of the things is that you know, what we know is that persons with more serious mental illness actually have a life expectancy rate that is around 14 to 30 years lower than the general population. That's really a staggering fact, and the reason why is typically because you see higher rates of chronic disease, so diabetes, heart disease, pulmonary disease, because people don't get the appropriate care and treatment, right? And a lot of the time, folks in that group are also experiencing homelessness, which is an incredibly stressful experience. And we know that chronic stress increases risk for chronic disease. And so it really makes a tremendous amount of sense that we're trying to pair interventions like housing with community-based care together. And during the time of COVID, really focusing those supports on some folks who are at the highest risk of having complications or, you know, worse related to coronavirus.
Exactly, and then these are the same folks who often will cycle through the emergency departments and, you know,
first responder services, and those systems are really not set up to address people's underlying needs.
They take care of, you know, in the emergency department at that moment, but then what comes next?
And it's often stressful, traumatizing to kind of cycle through that over and over and over again and not get your needs met. And so I think it's exciting. We're moving in a kind of different direction on that, and I'm really excited about it.
Yeah, so I mean, this investment was something that we were really, you know, we were wanting to do and planning to do with the mayor's support prior to COVID. But I think now it's sort of saying for some of the, you know, these very highest risk people, how can they move into more permanent supportive housing with the mental health supports like these new teams to kind of support it. And so it's, you know, we're on the same page about this, but we are really excited about this direction and sort of the city taking on some of the support for really our most vulnerable residents in a lot of ways. So
it's really exciting.
Yeah, definitely. All right, let's get to some more questions here. Okay. So Joanne DeSanctis Kirk on Facebook says, we know all the COVID statistics, so she's probably following along well here. Can you tell us if the incidence of suicide, overdose, domestic violence has increased during the stay-at-home order?
Yeah, so that's a great question. So we are monitoring all of that. So one thing I can tell you on our team is that we actually track data related to all of those things, and we're checking it, really updating it kind of week to week, because you want to monitor it so that we can make you know, interventions and changes accordingly. So with suicide, you know, we haven't seen really significant increases in crisis-related calls to the police department, the fire department yet. Other municipalities have reported increases. We have seen a lot of increases to helplines requesting support. So some of the suicide prevention hotlines are the NAMI helpline that's linked to 311 has seen very significant increases in services. And so we're definitely thinking about really strengthening our suicide prevention programs in the city. It's a high priority for us, and I think we'll have more to say about that. I think domestic violence, you know, is complicated because we've seen increases in the rates of calls to the DV hotlines. And there have been increases in the domestic violence incidents reported. Sometimes the way domestic violence can just mean, you know, violence that occurs in a home with a person you live with, so it's not necessarily intimate partner violence, and so we're monitoring both of those. One of the things is that COVID can impact people's willingness to report, because if you're living in close proximity with a person about whom you feel unsafe, you may not feel that you have the space or the ability to report it. So that's there's a lot of complications with monitoring that. With overdose, we are seeing some increases.
Yeah.
And it's something that we're currently, we have some plans around, and I know we're going to be talking more about that in the coming weeks. So it's something we monitor, it's something that we have plans to address.
Yeah, and I noted yesterday at the press conference, again, I think there's some new technology here and new ways that folks are reaching out. So even like the national hotline, SAMHSA is the Substance Abuse and Mental Health, sort of the hotline, and they noted that just last month they had 20,000 people text the hotline for help, whereas a year ago they'd had fewer than 2,000.
That's right.
And so these huge increases in terms of people reaching out too, which is good. And we know, I mean, this has been so destabilizing for people in so many ways.
And we know, there have been surveys done in Chicago about how COVID is impacting people's mental health. So Northwestern, University of Chicago have done these surveys, and something you kind of keep seeing in that is people reporting heightened levels of loneliness, social isolation, also people reporting higher levels of hopelessness, meaning when people kind of think about the future, they don't have confidence that the future is going to be positive, feels something that they feel connected to and empowered about. And so I think that's another whole piece of this is helping kind of, as we move into this recovery process, is really thinking about things like unemployment, thinking about things like housing stability. How are those connected to people's mental health?
Right.
And economic insecurity. I mean, those are all, when we're intervening on those levels, those are also mental health interventions. And so it's something we're working with our colleagues who are working in those areas to think together about.
Yeah, that, I was really struck with that Northwestern, it's this coronavirus data survey, and they asked the question, basically you agree or disagree with the statement, I feel very isolated. So it's not just I feel a little lonely, I feel very isolated.
Very isolated.
44% of people
were
saying, I feel very isolated.
And we'd been talking about this at the health department again before coronavirus, but isolation and loneliness are public health issues. So loneliness is actually really bad for our health when we experience it in a long-term way. Of course, it's a normal human experience, it's a normal human emotion. But when you experience it for long periods of time, it is as bad for us as smoking a pack of cigarettes a day. And a lot of people don't know that because we don't talk about it that much. We've sort of talked about loneliness as just, it's an uncomfortable feeling. It's actually a lot more than that. It's a critical public health issue. And so I think COVID has highlighted this issue even more. I worry a lot about older adults, people with the pre-existing conditions where we're recommending for their own safety, right, for them to be isolating at home, but then there's the psychological and mental health toll of that. And so that's where, we need to be working together, and those of us that are working on mental health are thinking about, okay, how do we support people feeling connected to their communities, to their families right now? Because we know that's not only going to be good for their mental health, but over time, it actually can help address some of the chronic diseases that are actually increasing their risk for COVID complications.
Right, absolutely. All right. Bouquet Yvette from Facebook. I am so afraid right now. There's mental health issues. I'm so afraid right now because I tested positive and have been sick for 11 days. My grandsons live with me, and I have made them stay in one part of the house. My question is, how do I keep them safe? Bouquet, I hope I'm pronouncing your name right. First, I'm sorry you're sick. I hope you're doing okay. If you've already been sick for 11 days, my hope is that you're sort of getting to the point where you're over this. If you are not starting to feel better, please make sure that you are in touch with your doctor. If you're not sure how to do that, we can get you connected through the website. You can call. Usually, what I'll remind just you, but everybody, that we think about sort of the period of being contagious or infectious as being 10 days from when symptoms start and the last 3 days once your fever is gone and you're really feeling better. So if it's been 11 days and you're really feeling back to normal, you actually should be in a point where you don't have to worry about spreading to the grandsons anymore. And if it's been at least 11 days, really it's just when you've had at least 3 days where you're not having fever, not having to take any of the medicines, Tylenol, ibuprofen, that would bring it down. As long as you've been to 3 days, you don't have to be as concerned about that. But I think the fact that you've been trying to stay in one part of the house and the grandsons in the other part of the house is perfect. That's exactly what you should be doing. Having folks, hand washing is really important. Not getting close within 6 feet. If it's possible, if you are sort of even in the vicinity, wearing masks. But this is hard. And, I think, your question really points to that it's not just the physical, but it's how do I keep them safe and being afraid. Do you want to chime in there?
I wanted to talk, thank you for reaching out, and I'm sorry to hear that you haven't been feeling well for a while. I think, part of the thing about fear is sometimes, we keep our fears on the inside and we don't kind of share them with other people and give other people the opportunity to help us hold the fear that we have, right? And so, you're a physician, I'm not a physician. I know sometimes I will be worried about my health, but I will feel self-conscious about telling my doctor what I am worried about. And so one thing I always recommend to people is tell your doctor what you're worried about. Is there something that you're particularly concerned about, and they can help you kind of understand things you can be doing. Is it a thing that they're concerned about? Another thing is thinking, and maybe you're already doing these things, I'm not presuming you're not, but I just want to make sure that you're feeling supported, is who in your life can you be connecting with every day right now to share how you're feeling, if you're anxious, if you're worried, helping share that with somebody else. We know that when we're feeling connected, it helps ground us. It helps us feel seen. It helps us feel less alone, that you're not alone in this. Other people who care about you are going to help you move through this process. So, and you did that by reaching out, right? You asked for help in doing that. So thank you for doing that.
And I think, if there's not someone who you're connected to, potentially reaching out, through one of the lines, right?
Is going to our coronavirus website and giving us a call, giving the helpline a call, giving our mental health clinics a call, and we would love to be able to support you.
And I'll just, I don't know how old your grandsons are, but again, I'll remind you that really, by and large, this has been good news about children, that generally children have been much less likely to get ill, or where they do, much less likely to get seriously ill have really serious outcomes. So I hope you're feeling better by now, and do think about not just your physical health, but your mental health at the same time. Okay, we've got, let's see. So Emily York on Facebook, this one's a little more for me.
Okay.
If the vaccine, but you could chime in, if the vaccine becomes mandatory, how can we ensure we will be safe taking it? So, we don't yet know the timing of when a vaccine will be available. I have been watching this very closely, as you know, and I think optimistically it'll probably be early 2021, but we'll see. And in terms of this, will it become mandatory? I doubt that it will be mandatory in a everybody must get this vaccine kind of way. However, what we often see with vaccines is that there will be settings where it is mandatory. So it may be mandatory, for example, unless you have exemption, there's a medical reason why you can't get it, to be in school, for example, or perhaps in a workplace. Right now, for example, flu vaccines are mandatory for healthcare workers in most settings. And so we will see sort of how this all plays out. Our goal here in Chicago is to make sure that we are ready in terms of having not just the vaccine itself, but sort of all of the planning, all of the syringes, all of the thinking about social distancing really in line to make sure that it is available. absolutely. The reason it takes as long as it does to get to a vaccine is to make sure that it is safe. There will not be a vaccine that is released until we are sure that it is safe. And that's part of why these phase 1 studies that have just gotten through, those are the first part of the safety studies. And now we're in phase 2 for some of the vaccine candidates that are starting to look at more about, how well do they work. And then phase 3, where we open it up more broadly. They're, making sure it's safe is the number one thing that happens with all vaccines. And then number 2, making sure that they work, meaning that they are able to confer at least some amount of immunity in a way that doesn't just last a few weeks, that lasts long enough. So, I absolutely will be very, very early in getting a vaccine as soon as it is available. And I am really excited about that eventually being part of our arsenal of getting back to normal. So do you want to chime in anything there? Okay.
I think that's your
That's my
terrain.
territory.
Yes.
That's my territory.
I know my lane.
Yeah, here's one for you though. So
good.
Got a question. So how do you combat loneliness while following the stay at home?
Yeah, that's a great question. So, I think part of it is thinking in new ways about how we connect with people, right? It's so hard because part of how we connect with people is by being physically present with others. It could be human touch, closeness, physical closeness and proximity, but connection is also an internal experience we have, right? You can have the experience of being physically close to somebody, but not feeling close to them, if you know what I mean. And so loneliness is really about how we feel relative to someone else. And so we can actually build closeness in our lives even when we are not able to be physically close. So that could mean being socially distanced in a physical setting, like outside. But I think for a lot of us right now, it's using the telephone, it's using these digital platforms like Zoom, like I confess, I, as my partner can attest, am not skillful. I'm, not skillful at these things at all. But I've needed to start, practicing with those things. I've also been trying to reach out to people in my life, that I hadn't connected with in a long time. So kind of using this as an opportunity. If you think about people in your life, somebody that you care about, but, life has gotten busy and it's been a year since I've spoken to that person. Give yourself an opportunity to try to connect in a new way with somebody right now. And if you feel vulnerable using these digital tools, now is a good chance to lean into it. The example I gave is my mom, who, I grew up in the South in the 80s and 90s as a gay person, and my mom has always been, my champion. And there is nothing really in my life that I've accomplished, without my mom and dad. They have been in my corner. And it was my mom's 70th birthday last month. And, we had planned this whole thing, and it really didn't feel like right in what we had in mind that we did it digitally. But it was what we needed to do to protect her and my dad. And so we celebrated her and honored her, through that mechanism. And it ended up being like a special thing. And I felt very vulnerable doing it because I don't use these tools normally. So I think those are some things I would think about is how can you cultivate that feeling of closeness in your life with other people, even if you can't be physically close to them, whether that's socially distanced physical relationships like outside, it's using these tools in new ways. Create special events like, we've been doing things like watching a movie, the same movie with a bunch of our friends on a Friday night, like that. And then try reaching out to somebody or people that you have been meaning to connect with but haven't been able to, right? Those are some things to try.
Yeah, absolutely. Okay. Well, we're getting all sorts of different things coming in here. Let's sort of stick on this topic. So, what can we expect to be different for counseling not in person?
Yeah, I mean, it's a good question. I think that you've talked about the risks of sustained contact, right? So when we're within 6 feet for
we're
long
socially
period,
distanced.
you and I are socially distanced right now. Before, it's the side turn, right?
Exactly.
And regularly, if you see a therapist in the same room, you're often quite close. I mean, maybe more than 6 feet apart. And I think therapists will interpret that in different ways. Some people will continue to see people maybe in person based on the guidelines, but will observe the social distancing. Will there be masking? There will be lots of hand sanitizer, I'm sure.
Yes.
But I can imagine there will be others that will not want to do that, right? And will want to continue to provide counseling over the phone or using telemedicine. And I think that's where it's really important to be communicating with your therapist. So for instance, if the therapist is just using the phone, but for you visually seeing them and being seen, there's really no reason why you can't use a telemedicine platform. The one that we, as you know, that we purchased a sort of a one for mental health clinics, but there's a free version of that one. There's many other ones, right, that you could use. And so that's a way for you to still visually see your therapist and for them to see you. And we know from a research perspective that the outcomes are still very good when we do that. But I do think you're going to see for a while that there's going to be less in-person counseling, and when there is in-person counseling, there's going to be the social distancing, there's going to be the masking, and I think making sure that you're bringing up with your therapist how that's making you feel, how is it impacting the relationship that you have, kind of bringing that into the room, that's a really important part of counseling.
And Ronald Grace from Facebook is adding on there, how exactly will the city use Doxy?
Yeah, so I mean, we just announced it yesterday. So there's lots of different things we're doing right now. So we're doing a technology audit to make sure all of our computers can support are going to be able to support it, because otherwise we're going to replace hardware and add cameras. There's all kinds of stuff we're doing, looking at the speed of the internet connection. But the long-term vision is really that services that we deliver right now in person will all be available through telemedicine. So we do individual and group psychotherapy. I'm excited to work with our teams and the clinics to really think together about what it's going to look like for us to be able to offer those digitally. We right now do psychiatry in person. We also have a partnership with Cook County Health System where they actually do some telepsychiatry, but the patient still needs to actually come into our clinic. So I think there's going to be some interesting conversations about what does it mean to deliver services to patients maybe from their own home. We also do case management. So any service that we offer, our goal over the long term is going to be able to be in a situation where we can deliver that service to a patient if they choose to receive it from their own home. So that's what I expect it to look like.
Okay, great. Juan Romero on Facebook. I would like to ask if after exposure, how many days before symptoms appear? I was exposed Sunday and I haven't felt any symptoms as of today. Okay, Juan, so this is where the quarantine period or idea comes in. So if you know that you were exposed on Sunday, the reason why we ask you to, I mean, everybody is under the stay-at-home order right now, but even if you're an essential worker, the reason we want you quarantining for 14 days is that it can take up to 14 days for that infection to take hold and for you to develop symptoms and get sick. So the average amount of time that it takes is about 5 days, we think. And so the fact that it's now been, you said Sunday, so you're sort of right at that time period where if you were in fact infected, you would be most likely to start to develop symptoms. But we really ask you to think about sort of 14 days from Sunday, so another week and a bit there, because it can be that amount of time, and that's actually where the quarantine comes from. So good question. I'm glad you haven't gotten symptoms yet. Okay, Mike White on Facebook. What is your take on the new CDC findings that the virus does not easily transmit on surfaces? So I am in agreement with the new CDC findings, only because, all along we've been talking about the fact, right, that like the biggest risk is that close interaction within 6 feet with the living, breathing people. Like that is by far the biggest concern, because that is when we've got droplets we've got coming out of our mouth. This is how it primarily gets transmitted. Lower than that is the risk on the surfaces, and so that's why we want the hand washing, we want the cleaning, but it is the close personal interaction that is the biggest concern. And so that's why you hear us really emphasizing so much, first of all, must stay home if you are sick, even a little bit sick, number one. Number two, keep that 6-foot social distancing every opportunity that you have, unless it's someone who you sort of made a conscious decision that they're going to be part of your sort of your bubble, if you will. Number 3, wear that cloth face covering. That helps mostly protect others. And number 4, keep doing the hand hygiene. And those are really in order of importance where we think about the risk for infection. Okay. We're getting close on time, but I did want to just mention, we've got a couple questions here about, we've been talking on here a lot about the sort of some of the race ethnicity differences that we've seen. And we've got a question about do we know anything about how mental health issues are impacting people from different race ethnic groups related to COVID?
Yeah, so, I think, as you know, when we were developing our framework, back, and the mayor was developing her framework back in the fall, something we really, observed was that there was a critical need to really build more services in communities, primarily on the south and west side, primarily communities of color. And so it's a critical part of our plan is to build more services in those communities. And I think we feel the urgency of that even more now, because if communities are being disproportionately impacted by this pandemic, right, it increases levels of stress and anxiety, it increases grief, it increases trauma that builds on what we call cumulative trauma, where an experience of trauma sort of accelerates past experiences of trauma. The second thing is what we announced yesterday actually was very intentional about building more of these community-based treatment teams that we've been talking about, specifically on the south and west side. So that was a very, very specific investment in that, and 4 of our 5 city clinics are also in south and west side communities, primarily communities of color. And so we recognize this impacts everyone, right? This increases stress and anxiety for everyone. So certainly everybody is impacted at the same time. Not all communities have been equally impacted, right?
And let's actually, to that point, there is some data here. Can we pull up, we've got a slide here.
The hospitalization data.
Yeah, I wasn't necessarily going to talk about it, but it's a good question. So this actually gets at people who have behavioral health problems in Chicago that are severe enough they need to be hospitalized, right?
Yes.
And if you look at this, this really shows that this is from 2017 because this is where we're doing sort of updates every couple of years, but it gives you the general sense. This is from the Health Atlas. We had 47,000 hospitalizations for behavioral health in Chicago in that year. But if you look at this difference here, first of all, over half of those hospitalizations were in black residents, significantly higher than in any of the other race or ethnic groups. I'll remind you, about 30% of the population is African American. But also, if we look at this slide is about economic hardship. So economic hardship is an indicator that we use at the health department that pulls together 6 different things. So poverty, unemployment, crowded housing, dependency, meaning how many people are living who are dependent on
13 to 64.
Exactly. And then income. And so as you can see on this graph here, that of those 47,000 hospitalizations, 6,000 of them were among people who lived in these low economic hardship neighborhoods of Chicago. So generally the ones that had higher income, et cetera. 14,000 were in community areas that had the medium economic hardship, and then 27,000 were in the high economic hardship. Do you want to speak a little bit about that?
So I think what that kind of speaks to is this broader point of thinking about things like how does unemployment, how does community violence, how does disinvestment in neighborhoods impact people's well-being, right? There's such a strong interconnection, right, that we know about between economic hardship in the city of Chicago and race, right? It's a long, long history. And so one of the things we're trying to think about is how do we build mental health services in communities that most need it, but how do we also at the same time think about how some of these long-standing issues, Invest Southwest, I've always made the argument, is a mental health intervention. It's moving lots of resources, neighborhood development resources, into communities on the south and west side. That is itself a mental health intervention, right? The investments that we're making in terms of community safety with our street outreach services, that is going to be a mental health intervention, right? And so, you know, the mayor's used the phrase all hands on deck, you know, that we need to combine and sort of braid together all these resources. I think it's a very smart approach, and our mental health investments are just going to kind of follow that same pattern.
All right, great. So we are at time.
Wow, that does go fast.
I told you. Yeah. Time flies when you're having fun. Thank you, everybody, really,
Thanks,
for putting
everybody.
in your questions. Thanks again. This is Matt Richards, our Deputy Commissioner for Behavioral Health. We always end sort of on a good news note. If you have any good news or suggestions for the day, anything you want to share with folks.
Yeah, just a self-care reminder. You know, I know that everyone's excited to get outside. I know I am. And it's certainly good to be outside, but just a few like easy things to remember to stay feeling well. So one thing is, to the extent that you can, trying to get some physical exercise. I know the lakefront's not open, but there's still ways to safely get exercise in your neighborhood, in your own home. We know that improves our well-being. Make sure you're getting a good night's sleep, at least 7 hours for most people. Try practicing, really trying to cultivate connection with other people. Connection always supports our well-being. If you're finding yourself worried about coronavirus, about things that it has set in motion like unemployment, please reach out for help. Please reach out to the NAMI helpline, reach out to the resources on our webpage so we can get you connected to economic supports, food insecurity supports, while the city's coming back online. You're not alone, and we want you to feel supported right now. I hope you have a good weekend.
Thanks, Matt.
Thank you.
I'll just highlight that Project Hood, H-O-O-D, and New Beginnings Church will be handing out coronavirus relief packages to residents this weekend. So it's open to any area residents in need starting 10 a.m. on Sunday. You can either walk up or drive up. It's at 6620 South King Drive. And there will be boxes that have fruits and vegetables and meats and dry goods, personal hygiene items.
Great.
You have to wear a face mask. You have to practice the social distancing. But another just nice example. We've got these popping up all over the city. And we'll end with a nice picture that we had sent in. This was some Chicago flag balloons that were spotted up in Chicago's Lincoln Park neighborhood. I love seeing when people sort of, bring hope and lift the spirit. So nice job to whoever home this was in terms of spreading some cheer in advance of Memorial Day. So join us at 1 o'clock if you like for the press conference today. More details looking ahead toward moving to stage 3, cautiously reopen, and we'll be back tomorrow at our normal time. At 11:30, sorry, thank you. Just double checking. So 11:30 tomorrow, we'll be doing some updates, and we'll be doing a deep data dive actually on all of the reopening metrics tomorrow. So if you're interested in the data, it's Science Saturday, so come ready to
Science Saturday.
Come ready
your favorite day.
My favorite day. Come ready to look at the data, and with that, really have a good afternoon, everyone. Please continue to stay home and save lives. We'll see you tomorrow at 11:30.
Take care.